So let's do this together. I'm going to show you the mirror, and I want you to take a peek in the mirror and tell me what bothers you the most, or what areas you want to focus on. Okay?
Okay. I would like to get a little bit more lift here in my cheeks, a little bit of lift up here in my forehead, and maybe get some of these fine lines down around my smile area. Get those removed if we can make that happen.
Sure. Okay. And how about your lips? Do you want to do a little bit on the lips or anything? You had mentioned earlier that you wanted to define the lips a little bit more.
Yeah, a little bit more on the lips.
Okay. All right. So what happens over time, and I think we've talked about this in the past, is that over time you not only lose the collagen and elastic fibers in your skin, but you also lose beneath that you lose the fat, the muscle, and the bone. So over time your bone in your skull actually shrinks, which is one of the reasons why people have to get dental work as they age, because their whole jaw shifts. You also lose the muscle tone, and you lose these fat pads. You have some beautiful fat pads that everybody has when they're young, but over time they shrink and they fall. So that gives us this appearance of looking sad and tired by pulling down, giving you an upside down V look. You also get more prominence of this fold, and that adds, so you almost get a double V that really adds to that look of tiredness and aging. So we have to compensate for that by doing the fillers, and we can do that. We usually use the fillers in the cheek area here. We use the fillers in here, and we use the fillers down in here. They can also be used along the edge of the lip to enhance the lip line. They can even be used now in the lip without any problem. And we can put a little bit in here to help lessen that jowl look. Okay. In here we use, on the upper part of the face, as you might remember, we use neurotoxins. And neurotoxins actually diminish the movement of the muscle. And so we put them strategically placed, predominantly along the front of along the forehead itself, to minimize the lines that are going this way horizontally across the forehead. We also put them in the triangle area right here, which is called the glabella, and that minimizes the movement of the muscles that go this way and the muscle that goes this way. So that takes away what we call the 11s, the little lines that go across there. And then we also put it over here in order to actually give you a little lift. It's called the chemical lift, and it lifts the lateral aspect of the eyebrow. It also softens these lines along here, the crow's feet. So I think in a combination, when you do all that, it'll be a new you.
Okay, let's get started.
Great. All right.